All right, thanks, Brett. Afternoon, everyone. Thanks for taking time to hop on the call with us today, our weekly update call. Just like usual, we'll go ahead and review we'll start with a review of the data. So Jordan, if you want to go ahead.
Sounds good. Hopefully sharing my screen goes better than it did the other day. All right, should be seeing the My Safe Start County data. And you can see that all of our counties are in the E-risk level. So Crawford did move back up due to a slight increase in their cases, but not that they were having many before. So still looking okay there. Our overall daily cases per million and percent positivity continue to trend downward, with our percent positivity sort of hanging out in that 13% range. And we have seen a 23% decrease in cases when we compare this week to the previous week. So the cases we saw in the past week were identified as household and community contact, school, including colleges, sports teams, and sports testing, daycare, social gathering, recent travel, and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday was 19,103, and cases by county as of yesterday are Crawford with 901, Kalkaska 1,014, Lake 562, Manistee 1,090, Mason 1,971, Mecosta 2,928, with Ferris State reporting 734 cases, Masaki 1,227, Newaygo 4,352, Oceana 2,568, and Wexford 2,490. In the past week, we had 13 deaths reported to us and 1,258 people who recovered. So you can tell that about 30 days ago is when our cases picked up a little bit, and they've gone down since then. Yesterday, there were 7 positive inpatient cases at Munson Healthcare Cadillac, 5 at Munson Grayling, 0 at Munson Manistee, 7 at Spectrum Health Big Rapids, 9 at Spectrum Health Gerber Memorial, and 6 at Spectrum Health Ludington. And I'll switch over to our vaccine table here. So as of yesterday, this percentage of people who were vaccinated was 55.4% for the whole state of Michigan. And those are people who initiated their vaccine series, which means that the first step for the My Vac to Normal plan has been reached, and the next step is at 60%. So that 55.4% number, which is not anywhere on the screen, is coming from the CDC tracker, not MDHHS's COVID-19 dashboard, because it includes residents that were vaccinated by Veterans Affairs, Department of Defense, Bureau of Prisons, and out-of-state providers. And that data is only provided at the state level, so any county level data, like the one I'm showing here, will continue to come from the MDHHS COVID-19 dashboard. And we also have the tabs of by county and by age group, how residents are initiating vaccination, and also the completion rates for you to take a look at as well. So only 2 of our counties so far have reached a 55% threshold for initiation, and those are Manistee and Mason counties, and they both reached that threshold on April 29th. Are there any questions?
All right, thanks, Jordan. All right, guys. Well, there was released this afternoon, actually just a couple minutes ago. CDC did make a new announcement that, and this pertains to fully vaccinated individuals. And anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physically distancing. So now, important to note, CDC has, while CDC has made this announcement, we still do here in Michigan have the epidemic order in place and the MyOSHA rules in place. And so until those guidances or orders change, then technically you would still need to wear a mask. But in the past, the orders and that have been updated as CDC guidance has changed, and so I would anticipate that they would be changing. I have not read through the entire document right now, or yet, I guess I should say, but I will try to get through it once this call gets done. But again, that is the newest CDC guidance that I'm seeing. And again, fully vaccinated individuals. And again, fully vaccinated means that it's 2 weeks or more since your second shot of a 2-shot series, or 2 weeks or more since you received your dose of Johnson & Johnson. You are then considered to be fully vaccinated. So that just continues to add to the benefits of being fully vaccinated or getting vaccinated. As an agency, we do continue to offer vaccination clinics. Yesterday, ACEP did approve, FDA on Monday approved the Pfizer vaccine for children 12 and up to be vaccinated with, and yesterday ACEP did follow that up by signing off on that recommendation. So we now are able to vaccinate with Pfizer vaccine children who are 12 and up, and we have begun to do that in our clinics. We saw some of those, we did vaccinate some of those kids on Tuesday that we already had on the schedule in anticipation of that announcement coming earlier or later last week. But so rather than reschedule them, our medical director was okay with us going in and vaccinating them. But now we have officially started to promote the availability of vaccine to 12 and unders, or 12 and up, I'm sorry. So our clinic schedule, and individuals attending one of our clinics, whether it's a first dose clinic or a second dose clinic, you can have an appointment, you can walk in. We're making all 3 types of vaccine available. You tell us what it is you want, and we will go ahead and vaccinate the individuals. With the walk-in piece, if it's not a Tuesday or it's not a Friday, probably a good idea to call one of our offices ahead of time if you do want to get vaccinated, just to make sure that we have a staff person there that's able to vaccinate them. So you don't come in and we don't have a nurse or a tech on hand that can do vaccinations. So we have seen a dramatic drop off in the number of people scheduling clinics, but we also are starting to see a number of walk-ins that are coming in. As an example, in Wexford County, and this is the only number I remember, on Tuesday's clinic, we had 34 people who had actually signed up for it. But in addition, we had a total of 40 walk-ins that showed up. So we'll be, I'll be curious to see what tomorrow's totals look like for walk-ins when we get them. As I've mentioned before, we have made the pivot away from focusing on kind of the scheduled larger mass vax clinics to more pop-up type clinics, community population specific clinics. And so a couple examples of that are last Saturday, we were out at the Mesic Mushroom Festival here in Wexford County. We only vaccinated 7 people, but those were 7 people that were hesitant to get vaccinated. They had no intention of coming into our office to get vaccinated. They had no intention of going to their doctor's office to get vaccinated. They had no intention of going to the pharmacy to get vaccinated. And so, in talking with our staff, the fact that we were there and it was convenient for them, they chose, they were willing to get vaccinated. So that, while the numbers may not seem real high, again, right now with our, return to normal plan, basically based on that % vaccination, it's important that we get any and all who wish to be vaccinated. So anybody that is interested in getting vaccinated, have them contact the health department, or there's other places in the community. As I said, the pharmacies, FQHCs, health systems, provider offices, for the most part, all of those have vaccine and will work with them. In addition to that, yesterday we were at a work site in Manistee, and we had 3 people on the schedule, and by the end of the day we had probably close to 30 people that had gotten vaccinated. As part of that, one of our nurses did a presentation on vaccine to kind of address some of the hesitancy and answer questions that people have. And following that, we did have a whole slew of other individuals that came in and chose to get vaccinated. So that was good to see. This coming weekend on Saturday morning and early afternoon, we're going to be down. We'll have our mobile unit down in Newaygo County at the hazardous waste drop-off at the Road Commission, and so we'll be offering vaccines to individuals at that location. And then later that day, we're going to have a tent set up at Blessing of the Bikes in Baldwin, and we'll be offering vaccines in the downtown Baldwin area for individuals that are interested. So just an example of some of the changes in clinic focus that we are starting to move through now. And so our intent is to continue to do that. We know that these smaller clinics, we may only get 25, 30, maybe 50 people, but we've gotten everybody who's been actively motivated to get vaccinated, and now we have to go to where the people are to get the rest of them vaccinated. So that is what our intent is going to be. Some of the additional things, obviously, individuals that were fully vaccinated did not have to quarantine if they were exposed to someone who was positive with a COVID infection. They did not have to go through any testing if they travel. And now, apparently, with the new CDC, what CDC is saying is they can participate in indoor and outdoor activities with or without a mask. Now that, again, Michigan still has to modify their epidemic orders and the MIOSHA rules. So we'll see when that will take effect. But again, kind of moving in that direction of those individuals that are fully vaccinated to kind of begin to return to somewhat normal. The plan that was released, the My Vac to Normal plan that was released, that's a 4-step plan. Step 1 was to achieve 55% of those eligible, which was at that time defined as 16 and up, who have gotten their first, who have completed their first vaccination or their first shot. 2 weeks after that, then the work from home requirement would be lifted, although you still would have the other MIOSHA rules, workplace rules that you'd have to meet. Yesterday or the day before it was that we did meet that 55% mark. And so on the 24th, that work from home requirement will be lifted. Now, just so everyone is clear on this, if you're watching the state dashboard, the state vaccine dashboard out there, you might notice that doesn't necessarily reflect the 55% being met, but the data and the dashboard that's being used for this is a CDC dashboard. The reason for the difference is that the CDC dashboard is keeping track of the VA data. So all those individuals who are vaccinated through the VA, they were not necessarily getting put into the MICR system, which is our state system. So those individuals are identified. Data from the tribes is included in there. And then the names of individuals who have been vaccinated outside of the state, if they have not come back and requested that their information be put into the MICR system, they would not be counted here. But in the state and the federal system, they are. And so that is the reason for using the CDC dashboard as opposed to the state dashboard. And as I said, yesterday or the day before, we did hit that 55% mark. So the next step in there would be 60% of the eligible population. And again, that's 16 and up. I have not heard yet if the intent is going to be to drop the eligible down to 12 and up or not. But right now it's 16 and up. But once we reach 60% of the eligible population having gotten their first shot 2 weeks after that, and there would be an increase in indoor capacity at sports stadiums, conference centers, banquet halls, and funeral homes to 25%, increased capacity limits at gyms to 50%, and then the curfew on bars and restaurants would be lifted at 60%. Step 3 is going to be when we reach 65% of the eligible population having gotten their first shot, then all the indoor capacity limits, for the most part, there would still be some some, depending upon the size, might have some social distancing requirements, but for the most part, the indoor capacity limits would be lifted. And then there'd be further reductions in the limits on residential social type gatherings. And then step 4 is the last one. 2 weeks after we've reached that 70% of the eligible population getting their first shot, and 70% is considered to be that bare minimum for herd immunity. But once we reach that, for the most part, all of the capacity limits, the limits on gatherings and face masks would be lifted at that part, again, with the exception of some larger type events where it still may be required that masks are going to be worn. So that is the 4-step plan. Again, a lot of it is driven by vaccination now, and as you see, CDC continues to provide additional benefits, if you want to call them, to those individuals that are fully vaccinated. Jordan did present our data, and as she had indicated, we are starting to see, knock on wood, hopefully a turning point where we're starting to see a decline in cases, and hoping that is going to continue. So that, I believe, is the information that I have to share today. I don't know, Jordan or Brett, if you guys have anything that you'd like to share or anything else that you'd want to share.
Just to piggyback off your comment a little bit about the CDC tracker, if you do go to the state dashboard, they have the tracker at the top. So you can tell right there where the CDC data is at.
Okay.
Nothing for me.
Okay. All right. Then I guess we can see if anybody has any questions.
Brett?
Yes.
Yes, Paul at Oceana County. And I wondered how many we'll have tomorrow, second dose at the Oceana County Fairgrounds.
Don't quote me on this, but I thought it was in the 400s.
Oh my, a big one.
Yep. A little bit
Alrighty,
smaller than what we've been doing, but still fairly big.
that's a big one. And we will have the gates open early in the morning and be ready for your crew.
Sounds good. Thanks.
Thank you.
Other questions or comments? No? Okay. Well, I guess one thing I know, and I've asked this question before, and at that time, the consensus from the group was they wanted to kind of continue to do these on a weekly basis. Is that still the feeling of the group, or do you want to go to every other week? What's your preference? It makes no difference to me or to the health department. I want to do what's going to be beneficial for you guys.
I think every other.
Anyone else have a thought on it?
I think unless there's anything really big changing, every other week would be fine with me. This is Joe at Manistee County Medical Care.
Okay.
And this is Joe at Newaygo County Commission on Aging. I'm fine with every other too.
All right. So why don't we do this then? We'll go ahead and plan to meet next week. And then the following week would be that Thursday before Memorial Day. And I'm not sure if anybody's got plans or is planning to kind of take some time off then, but why don't we'll skip that one and then we'll plan to meet the week after Memorial Day. Brett, are you okay if we making those changes then? I think you organized these.
Yep, no problem.
Okay, so the plan will be we'll meet again next Thursday and then every other week from there on. Jordan, that work for you okay?
Sounds good to me.
All right. And then just like, like always, if for some reason we need to pull you guys all together again, we can. And we'll go ahead and begin to incorporate in the 12 to the 15-year-old vaccination data, and could be able to continue to monitor where we are in the plan for returning. So if there's no other questions or nobody has anything else, That's all that I have for today, guys. Thanks again for taking time to hop on our update call, and we will talk with you next week.